Okay, it's Christmas time, and this ain't going to be your average end-of-year wrap-up. Oh no, this is Off-Label's Naughty and Nice List, Medical Affairs Edition. From the ghosts of Pharma Past to Santa's AI-powered sleigh, I'm joined by the one and only Carlos Eid, Medical Santa, King of Controversy and full-time Truth Slayer, to unpack what's working in medical affairs and what needs to be thrown out on Boxing Day. We talk buzzwords, bold futures, and what 2026 needs from every MSL, leader and patient-centric poser. So grab a gingerbread latte, hang your KPIs by the chimney with care, and join us as we slay through the future of medical affairs, one hot take at a time. Let's wrap up 2025 with impact. Let's go. And here we are, so excited about this last podcast session of the year for Off-Label. It's a Christmas theme. We've got good King Carlos, the Santa Claus of medical affairs, joining us. He's dressed to the nines in his fantastic Christmas garb. I feel underdressed and a bit underdone, but yeah, there's a bit of talk about AI. I'm going to see if I can AI-ify myself into a Christmas theme. I do have the Christmas spirit. It's just not visualised at the moment. Carlos, great to see you. I've had a great time catching up with you all year, but it's fantastic to finish up and see you now on this on our podcast. Thanks for being here.
Likewise. Thanks a lot, Steve. Such a nice opportunity to close the year with you, talking about medical affairs
controversial
and some reflections.
Stuff. For those
controversial stuff and and some reflections. I'll try my best to be the Santa and not the Grinch. So I look forward to a great discussion.
We can swap around Grinch and good Santa, bad Grinch, or good cop, bad cop, however it goes. For those who haven't caught up with Carlos and myself, we like to have a laugh and a bit of a joke. I really enjoy Carlos's insights and contributions to conferences because I've called him the King of Controversy, just because we like to challenge. And a lot of people get caught in the gears of saying the same things and towing the company line and rehashing things they may have read online. But we need to challenge people. Heading into 26, it's more important than ever before. And that's why I'm really happy to have you here, mate. It's going to be some good conversation. So just on that, we don't want to do a normal podcast. We want to have a little bit of fun.
Absolutely not.
Inject some Christmas flair, start to baste the turkey and put it in the oven and get things hot here in the kitchen. So I thought what we might do is work on what we'll call, say, the Naughty or Nice List, Medical Affairs Edition. Now, the premise is, so Santa's watching, so are the KOLs. Okay. I'm going to toss out some buzzwords, trends or behaviours.
Oh, God. Okay.
Bit of buzzword bingo sort of thing. And you've got to declare whether it's it's either naughty, so coal in the stocking, an overused term, it's misunderstood or it's holding us back, or if it's nice. So gift wrap for 2026, worth investing in, it's forward thinking, it's game changing, it's where we need to focus efforts moving into the future.
Brace for impact.
You got, yeah. Oh, impact. Impact, you've already dropped a buzzword. We haven't started yet. Rightio. So let's see how we go. Kicking off with ethical AI adoption. Where are we at? Naughty, nice.
Before we do that, I just want to give a very quick disclaimer that I'm here on behalf of myself, okay? Not representing my company in any way or form.
Very good.
Just to make sure that we have
there's a clear line in the sand or in the snow, exactly, as we say in the North Pole.
Exactly. So we can have the discussion a bit freely without insinuating that the company is doing something or the other.
Indeed.
Ethical AI use. Okay. So I think this goes into the nice list.
Hey.
I think there is great potential with AI beyond what is being used today. And medical affairs are finding ways of ethical AI use, of using it in their day-to-day work and also in insights, for example, in content, in medical information, in drug development, in clinical trial site optimization. So we see a lot of examples of AI use. I've witnessed some as well. We cannot go into the details, but there is a future definitely with AI, and I do see it needs to be on the nice list.
Yeah, I don't think there's any way. So it was a nice, easy one to ease our way into this one.
Yeah, come on, make it harder, Steve.
Okay. Well, look, everyone's talking. Okay, so I asked the room, I've done this several times in
Okay.
Med Affairs events, and I asked the room, how important is storytelling in medical affairs? And you know what? It's always a room split down the middle. Go, no, we only know the data. To the other one goes, yeah, but we got to relay it. And never the twain seem to meet. Where are you sitting on this one, Carlos?
Okay. So storytelling. Well, let's go to the room that is split. So the people who told you that the data and they don't want to go into storytelling, they will have a new name in 2026 called open evidence. So these are going to be the open evidence team because the data is now democratized. Everybody has access to the data, whether it's Gemini, ChatGPT, open evidence, depending on how accurate you need the data is there. And the HCPs are going to get it within seconds, and they're not going to wait for you to come knock on the door 2 weeks after a publication, because of course it takes you 2 weeks to get the slide deck done, to get it approved, MLR, and then you go to the physician and he's already seen the data 2 weeks
I'm falling asleep
earlier
already.
on. Exactly. So these guys can have their CVs ready because they're going to need it in the coming
Open
years.
evidence is coming for you. Right.
And other platforms. I mean,
yeah, well, it's just the first, right? And there's usually a few false starts before we settle on something.
Absolutely.
Yep, I'm with you there. Hang on.
Let's go for the other half of the room. Or do you want to comment on the first half of the room before I go there?
No, I'm with you. I think I like the direction that you're heading. Let's tear into room half number 2.
Okay, room half number 2 that considers storytelling to be important. I don't know if people get misleaded by when they hear storytelling, they imagine bedtime stories and they imagine something that is not very scientific or very
bit more creative,
strong.
Isn't? Yeah.
Yeah.
Creative.
I think the point of storytelling, maybe we can give it another title. We can call it data contextualizing.
Yeah.
If that's an accurate term.
I think it is. Yeah.
Because one thing is getting the data, but the other thing is understanding how to use the data or how to understand the data or how to really analyze or understand the nuances of the data. And this will become the role of the MSL, that the doctor has already access to the data through open evidence or ChatGPT or Gemini. The MSL's role is going to be, okay, how do I contextualize that data for you? And how do I make it applicable to your day-to-day practice? And how do I answer potential hallucinations that you got from those platforms and really guide you through the accurate source of information that you need?
You make a really good point, especially with all the data that's going to be so readily accessible, particularly by digital natives that perhaps prefer that way of knowledge acquisition. If the industry is going to prosper from a field point perspective, they need to provide that value. And in order to provide it, they need to find succinct ways of providing it. And storytelling, I think, is going to, or contextualization is going to play a big role in that. So,
a new buzzword.
Put it on the nice list. Yeah, let's add it there. I'll put it down the bottom. Right, here's one I've heard a few people talking lately. Ad boards, right? Once they're the absolute gold standard in insights generation and understanding and planning. Now there's so much information, so many different places you can get it. They're starting to play around with personas and digital personas to start working on them. What's the future of ad boards? Is it naughty or is it nice?
Well, this is tricky because it depends. It depends why you are doing the ad board. It all starts with the purpose and the intent. If the purpose and the intent is that I want to bring 12 top names into a room, pay them money, expose them to our data, and become friends with them because now they're our the group of buddies that we are engaging with, and this is completely uncompliant, unethical, non-compliant, unethical, and definitely should not be done. Then I will put it on the naughty list. If the ad board, whether it's a virtual or a face-to-face ad board, is actually coming in with some pre-work, pre-reads, and then asking doctors from across the globe their opinions, their insights on certain readouts, certain market dynamics, certain actualities, let's say, or certain barriers or understanding of a patient journey, and getting those insights so that we're not just creating strategy and hypothesizing on things in our ivory towers, but also understanding what is the reality of things on the ground and making sure that this reality is incorporated. And I'm not going to go into the extra step of having patients on ad boards, which is also something that we should be looking at having patient ad boards. But then this needs and has to stay on the good list and not the naughty list or the nice list.
Yeah. So there's still
because you always need to have you need to always have the external voice. You cannot just rely on what you think you know internally.
I hear you. Okay, good. Well, let's touch on the while you're. Do you have to answer the door? Is that Santa? Is he early? I can hear a doorbell ring in the background.
I think based on my answer and the first non-compliant, it's the Santa police. They're coming here to pick me up.
Come to get you. You'll be in the North Pole jail before you know it. Okay, that leads on to a couple of things, but you touched on patient ad boards. Geez, Carlos, you and I have been going to these events for a long time. I remember first hearing the word patient centricity. It was 2007. I was standing on the platform at Hammersmith Tube Station, and I heard someone say it, and I went, oh, what a word. Finally, yes, of course we should be listening to patients. Makes all the sense. And since then, I'm not going to do any maths on how long ago that was, but it's just seemed to be mentioned every year. We have to listen to patients. We have to listen to patients. Seems like things are starting to generate now. There's a little bit momentum. I've personally witnessed quite a few of them lately, but what's going on in 2026? I presume this is a nice, but how's it going to take wing? I'm really interested in it. Or is it all still just all hearsay and lip service?
Okay, good one. Patient centricity. Definitely a buzzword. Definitely on the naughty list if companies are not doing anything about it.
Yes. Good.
But
flip.
it should be, and I don't want to sound cheesy, but it should be the title of the list. Okay. We are in pharma and we are in healthcare. And because of one main reason, which is treating patients, treating diseases, treating illnesses, prolonging life. So this is the main objective. Now, making money is what keeps the business running. If you don't make money, you cannot do research and development. You cannot come up with new innovative treatments. You cannot pay the salaries of the people who are working. And you cannot make also a profit for the shareholders and the people who believe in you and they are investing in you. So I don't think there is any business in the world, except for maybe NGOs or nonprofits, that do not work on making money, right? Even hospitals make money. Even doctors make money.
Yep.
So it's not like, they only care about the money. So this is why when we talk about patient centricity, it's important. I see a few things. So one is understanding the patient's needs, and then you incorporate those needs into your strategy or even your trials. Like if there's a certain endpoint that is of great interest for patients, having that voice heard and having that endpoint, and I've seen it happen in my company, having that endpoint incorporated into any of your, let's say, endpoints is something of crucial importance, because then you're doing something that resonates with patients. Also, understanding the patient needs in terms of education, like making sure you have the material either delivered by the HCPs or delivered digitally or on your platforms, making sure that the patient has the resources to understand his disease, to understand the mechanism of action, maybe of the drug, depending on which country you're in. So this is patient centricity, that you keep the patient in mind. Exactly.
Like in this whole co-creation process, and you hear nothing about me without me. And it all makes sense until you see so many people just going off, what they've been doing for decades, just thinking that they know better without the involvement of the patient. Adherence and compliance is just such an issue forever. But still, it's the only way to improve that is to be involving the patient and liaising with them to ask them what do you need? So for any brand that's not got a patient advisory board or committee or some focus group that they can lean on,
they're missing a lot.
Launch times, it's a disservice to the industry not to do it, in my opinion. So
Absolutely.
naughty if you're not doing patient affairs, patient centricity, or taking it seriously in next year. All right, we're talking about buzzwords. Let's have a little bit of a flip. Let's flip it on its head, Carlos. Let's try and explain what a buzzword is without using that buzzword. For example, what I'm thinking, let's explain impact in medical affairs without using the words data or relationships. Everyone wants to know about measuring impact and what it is. I think it's impossible, but you're a lot smarter than I am, so let's see you have a crack.
Okay. So I have to talk about impact without saying relationships and without saying data?
Yeah, explain what impact in medical affairs is without using the words data or relationships.
That's super easy.
Let's have it.
So impact in relation.
Yeah,
impact.
How do I need the sound effects.
I said impact in relation. So medical affairs impact is all about transforming patient lives or impacting outcomes through system changes and not through just doing plain activities that have no clear purpose. So as long as your activities are linked to a desired contribution that impacts behavioral change, and this behavioral change impacts a certain patient outcome or output, then you are on the right track of creating impact in medical affairs.
All right. I'm trying to make the clapping noise go on in the background here, but it's not. Oh, here we go. I've got it. Oh, it's buggy as all heck. Anyway, well done. He did it. Oh, here it comes. Better late than never. We're all well-oiled machines here at Off Label, but you did it, mate. Well done. Hats off. I didn't know how, but you pull it out of Santa's bag. Touch on now. This was really cool. You came up with this one, so I'm looking forward to the answers. We're all a Charles Dickens fan in one way or another for one of his most famous works. So let's have a bit of a Dickensian deep dive in how medical affairs has arrived on the scene today and where it might be heading. So let's reference the Christmas story and talk about the ghosts of Med-Affairs past, ghosts of Med-Affairs present, and of course the future. Love to hear your take on this particular lens.
Okay. So I love that book, by the way.
Oh, it's
if we go to the ghost of medical affairs past. So medical affairs, the ghost of medical affairs past, you could in 2 words as a title say service providers. So medical affairs past is actually the service providers that were just responsible for reviewing stuff, approving stuff, saying no, saying yes, getting the data or generating it, creating the material, providing it to commercial colleagues, going out and just disseminating the data. That's ghost of medical affairs past. And I'm hoping people listening here, there's not a lot still stuck in the past. If I look at the ghost of medical affairs present, what we are seeing now happening in the present, from adoption of AI, from being more strategic partners, working alongside commercial access, comms, advocacy. So being a true partner, having a true seat on the table, co-creating the strategy, disseminating the right data at the right time to the right HCPs, doing the engagements that lead to system changes and not just to drive data for the sake of it. So companies and teams that are doing that, welcome to the present. If also you're not doing that, then you're in the still Jurassic age maybe, and you still have to go to the Christmas past, Christmas present. And my God, it's going to be a long trip for you. It's going to be a long trip to go to the future. Because if I want to give a title to the Christmas present is the kind of the strategic bridge. We always talk about that, bridging from research and development to HCPs. It's a bridge. If I want to go into the ghost of the future, now there are many things you can think about for the future. One thing which I always say is that medical affairs are going to become the leaders in the future if they remain on the right track, filled with mindset, business acumen, communication,
the trajectory is pretty. Would support that.
So taking leadership, blurring the lines between R&D and medical affairs and commercialization. So it becomes more of a seamless journey. And I will add a bit of spice to that with the title of a predictive driver. And what I mean by predictive driver is the ability of medical affairs to become more proactive versus reactive. And the ability to, by using, for example, AI, predicting certain behaviors or questions or concerns or data gaps that might appear and acting on them now or before they actually happen. And being one step ahead in terms of getting the right things done and creating that impact in the community.
So say that's really insightful. Actually, it's kind of, you may have already done this in a way, but let's say you are Carlos from the future. You're operating at that level out there. You've now come back to visit Ebenezer at Pharma Company Past, and what are you're going to grab him and tell him what you got to do today to end up in this place that you're talking about now, future, or your company's going to become obsolete and left behind and not be able to maximize its business.
So what I will tell Ebenezer from the past is that, wake up before it's too late, because companies are going in that certain direction, and people who are still working in that old way of doing things are eventually going to become obsolete. So we can't give any more excuses that data privacy and AI hallucinates and compliance doesn't allow it and regulatory does not allow it. Even compliance, regulatory, AI, everyone's evolving. So let's stop making excuses and let's be more proactive in finding ways of keeping up with the future.
Yeah. I think
And there are two
embracing.
examples. Yeah, exactly. It's like the Kodak story. Like
Oh, yeah.
everyone was moving into digital and they still insisted that the cameras are going to work. And
That's
we've
right.
seen many examples of that. And even with what was the name? Blockbuster. Like people
Oh,
are
yeah.
still going to rent, and Blockbuster for me is like a bit the slide decks of MSLs, thinking that doctors are always going to ask for slide decks. We're going to always need MSLs to go there with a slide deck. And eventually they're going to be surprised that doctors are getting everything off the internet and they don't need that slide decks anymore. So then how
You're
do
right.
I make relevance for the MSLs? On average, you pay $250,000 for every FTE, for every MSL in any
It's
company.
extraordinary investment.
And of course, it ranges from the low
Mm.
income to the high income markets. But
Yep.
are we investing just to disseminate data where do you have much cheaper options of doing that? Yes, of course, it's the relationship, it's the advocacy, but I mean, that's a very costly relationship. So we need to make sure, again, as I said before, they become contextualizers, they become system changers. A
I
long
agree.
answer, but
Yeah,
that's
no,
what I
no,
would tell the ghosts of the past.
good. Well, I hope Ebenezer's listening because, in my opinion, to keep the controversy going, there are far too many Kodaks and blockbusters in the pharmaceutical industry with those types of
Yes.
slow-moving, non-agile thinking and lack of willingness to embrace the opportunities that are now presenting us to deliver true, meaningful value to HCPs and patients. It's an exciting time if it's managed appropriately, but it has to be. You have to walk forward. You can't go back to the past. We're going that way if we want to make it work, right?
Absolutely.
So third segment. Okay, I think we'll wrap it up after this one. We want to talk about Santa's. I think it's Santa's AI bag. It was the one we were kind of coming up with. So since the future's heavily tech dependent, people get their answers fast. Let's try and make this a rapid fire. Sort of a session. I'm going to describe a magical problem. Okay. So a magical medical affairs problem. Not so magical, actually. Someone's probably pretty real, but we're going to put a Christmassy magical theme on it. And Santa, you need to solve for medical affairs teams. So you've got 30 seconds thereabouts to invent a future tool or describe an existing AI solution or something that you may already be familiar with. You don't need to mention any names. Just do what you like.
Sure.
But and then we'll put an optional twist on that, and we'll rate each solution you come up with on a scale from reindeer worthy to needs more eggnog. That's
Oh, wow.
the two parameters we're working with. There's nothing in between. It's reindeer worthy or hit me with a lot more eggnog.
Hit me with eggnog.
Yep. Drown me in that stuff. So the scenarios. Let's have a look. So Santa needs to identify a rising star KOL in a brand new remote village on the edge of Lapland. How can he identify who's been naughty and nice out of those HCPs to find his KOL?
So this will most likely be, and there are some existing tools, but of course, you can always look at refining those tools. But I think the future would be that as medical affairs, you kind of specify a certain geography or area that you work in, and you ask for, or you try to map out, okay, I'm looking for someone who's specialized in this or that. And then based on their activity, based on their social media feeds, based on their publications, based on the lectures that they are giving in certain congresses, there is a tool that kind of collates all that information or gets all that information from the different publicly available information and gives you an answer within seconds saying that, oh, if you're looking for a rising star in that area, well, this is how the activity is going, or these are some of the activities that have been made by certain doctors, and also sharing profile CV, because most of that is available online. And now the great thing about the LLMs is that they kind of capture all that information and then they give you an answer in the form of a summary or a story. And this is what people are doing now. they're using the Google AI answers
Yep.
versus just clicking on the hyperlinks, which is a whole different story on how we need to improve search engine optimization, but we'll keep it
Yeah, yeah, 100%.
for another
I
discussion.
I agree with. I think that's it's reindeer worthy. Was that the one I had? This sort of KOL mapping software's been around for a long time. There's been companies come and go, and it's over a decade easily, I'd say. But now, yeah, you're right. With the advent of AI, it's really drilling down because you could easily miss someone just because they've been published a bunch of times. You don't know whereabouts or journals, and anyway, it's much tighter now. So good stuff. Moving on, the elves. In this case, we're going to refer to the MSLs as the elves. The elves are burnt out. They've just they're tired, they're cranky, and it's all from entering their insights into their CRM manually. How can we help them to re-energize them in time to get the toys ready for Christmas?
Okay, so obviously I'm gonna add to that because you can get a very
Yep.
short answer.
Yeah.
No, but
Lovely.
I guess the MSLs are cranky around a lot of stuff. So
Mhm.
not only putting the insights, but also working with clunky CRMs, also doing visits for the sake of visits because they're being told that you have a certain number of visits that you need to complete per week or per month. And the solution for all of that is not the solution, but something that could be very helpful for them is an AI assistant. So imagine that you have a nice, wonderful AI assistant. You get in your car, you tell, okay, I have an appointment with Dr. X. It guides you how to go there in the fastest route. And then while you're going there, this assistant kind of summarizes to you what happened in the last conversation. And then
That's
it
cool.
asks you, okay, what would you like to do now? And then, oh, I would like to discuss with him on this topic and that topic. Then the AI assistant would tell him, well, since you last met him, he did this presentation at the Congress on that topic. Would you like me to dig more into what he said? And maybe you can discuss that. And then you
That
say,
is
oh,
awesome.
yeah, that would be
Is it?
interesting. And then it creates some like talking points for the MSL. And then he does his visit. When he finishes his visit, maybe you use some sort of a recording that the doctor allows during that
Mhm.
visit. And then it gives him the quick summary points of that visit. What would you like me to input into the CRM? Okay, put points 1, 2, and 3. And then for the insights tool, put points 4 and 5. And then it does that. And voila, hands
Yeah, I mean,
off,
it could even
hands
throw
free.
in a call review sort of process as well. Talk about what
Yep.
you did right, what you did wrong, and that. So who's done? Surely someone's done this. We've got the big CRM wars happening right now. Viva and Salesforce are in an all-out brawl for world domination in health in pharma. Surely someone's upping the ante, and they're close. You don't need to say, but are we going to be there in this sort of instance soon, or are we a
I'm
long
not
way off?
sure about soon because there's still a lot of integration that needs to
Needs
happen
to
and
happen.
try to make it as seamless as possible. And then you have the different countries with the different requirements, with the different
Yeah, yep.
regulations. So
That's
there are a lot of
already
things
ironed out.
that would play into, and then language. So we're always
Mm.
conversing in English, but some of our biggest markets that I work with are China and Japan, and
Yep.
they already have like their local kind of tools that they are using. So then how do you integrate those tools with your tools? And that's a completely
Well,
different monster to address.
whoever figures that out wins the war. That's
Yeah.
because the model that you've just articulated is the Ghost of Christmas future. That's what they'll be. What they'll be rolling with, in my opinion. So Rudolph, he needs KOL insights and he needs them fast to light the way. How's he going to do that? What's the most effective way to pull on your KOL insights to inform a strategy?
So here there are 2 points. I don't think the problem is always the technology. I mean, if
Mm-hmm.
we look at AI was not just created last year. We've been using AI to summarize notes and to come up with like trending topics and to come up with like a volume of notes for each topic. And then you observe if that volume is decreasing or increasing after you do a certain action. We've been doing that since, I mean, 2000. Now, of course, it's getting better. Now you can have a chatbot associated to it where you could write into the chatbot, ask any question, and then it feeds on all the information or all the notes that you have and gives you an answer, which is really great. The solutions are out there. I think the challenges are more into the integration and the incorporation. Some companies are choosing to create in-house solutions. Others are going for service
third
providers.
parties.
A lot have it. I'm sure a lot are using it. I think that's one of the earliest adoptions of AI and Gen AI. But the actual problem is the quality of the data that is coming into those tools. So MSLs do complain a lot that, oh, you're not acting on our insights. Well, telling me the doctor does not like the drug, that's not an insight. Or telling me that we had a good discussion on this data and the doctor is happy, that's not an insight.
You've got to feed
You
it
need,
properly.
exactly, asking the 5 whys. There are plenty of ways, and plenty of people who can train your teams on generating good insights and doing them. So ping me and I'll give you a lot of trainers that will be happy to support you from outside the industry. But you need to get good data in so that those algorithms get good data out.
It's always been the problem. We always get so carried away with new shiny toys and what they're going to do, but the saying "garbage in, garbage out" is always going to resonate true. And you've got to feed it with the good stuff. Lots of milk and cookies. You've got to feed your AI engines with, not just Santa Claus on Christmas Eve. Righto, just a couple more. What do we got? We got Mrs. Doesn't often get a mention. The winged beneath Santa's wings, or sleigh.
Okay.
She needs to identify unmet patient needs in a rare disease in 24 hours. It's got to be fast. How's she going to uncover a patient need quickly?
Just look what they search for.
Yep.
So again, imagine that you have a certain AI tool that allows you to, on whatever disease you identify or you choose, allows you to understand across the globe patients that have that disease. What do they search for? What is their activity online? And what are they really worried about? And what are the questions that they ask? Maybe this AI tool could also be linked to another AI tool where HCPs are sharing insights about their patients. Yep. And then you sort of get your answer instead of doing a certain market research that might require 6 months to complete from
6 months and
end to
a lot
end.
of money. Yep.
Exactly.
Look, I like it. I think we've got 3 reindeer worthy. I think the last one, just because we're so dedicated in patient affairs and patient centricity, we got to find a way to do better. So we're going to say we need more eggnog in patient centricity. Yes. To keep it growing and on the right way. Okay, second last one, Carlos. And I call you the king of controversy. It's what I love about you. Is there a controversial topic that you just want to say we really need to iron out and address in 2026? What's your biggest present in Santa's sack for this one?
Well, I think I hinted to a lot of things during our conversation. I think it's still, well, if you want to say controversial topic, then I would say more, how are we using the MSLs? And let's be very honest. For the investment that you do for an MSL, trust me, there are a lot of cheaper options.
Oh, yeah.
If you're not using your MSLs properly. MSLs have the greatest value in the pre-launch phase, in the generating a market understanding, getting the insights, mapping the patient journey, looking into solutions or supporting the access team and the other teams in terms of, okay, how do we get that disease addressed or that product launched or that education that is needed. I've spoken a lot about the impactful contributions from scientific education to partnerships to healthcare system strengthening to evidence generation. This is where medical and MSLs can play a very major role. If people are still going to use MSLs shortly pre-launch and then widely post-launch, just to disseminate data and to be kind of the glorified sales reps that have access to KOLs, so that we convince them about the data. And I'm not saying everyone is doing that, but
it's not
a wrong investment.
Unheard of in the same breath either, is it?
I mean, it's a wrong investment. You can just train your sales rep because everything they're talking about is on label. Train your sales reps, try to make them more interesting for the big KOLs so that they meet with them and equip them with the data. And sales reps are more than capable of having deep scientific conversations as well. They're not untrainable. And now with AI and everything, they have all the equipment and the support that they need to have those conversations. So think twice when you're hiring an MSL on what is the actual value that he's going to bring that another function cannot bring it for you.
100%. Value is the key word. I couldn't agree more. It's a medical role, but it's a commercial decision.
Absolutely.
So, righto, let's wrap it up. One, you've been really good, Carlos. You deserve to make to sit on Santa's lap and ask for one thing for 2026. If you could ask the big guy, the big man in red, what's one thing in medical affairs? You could fix one thing in medical affairs for 2026. What would it be?
So I don't want to fix something. Okay.
Mm-hmm.
I think we've spoken about a lot of things to be fixed, from the MSL role to patient centricity. But
Sure.
maybe one wish I have for 2026 is that, first of all my colleagues and medical affairs associates worldwide, that they have a happy Christmas, a Merry Christmas, a Happy New Year, and that, 2026 will be a nice, a good, blessed, impactful year for all of them. We have to acknowledge that, yes, we are always thriving for perfection. We're always thriving to really become the leaders of the future. But we also have to acknowledge that the years that we're passing through are not very easy years, from economical situations to wars to instability to large restructurings that are happening in companies. A lot of changes that are happening, a lot of uncertainty and ambiguity. At the end of the day, we are parents, we are families. Yes, we are working in healthcare because we want to make an impact. We want to be pioneers of good health and promoting, or how do you say, improving patient outcomes. But
Yep.
we are also humans with families, with needs, and we have our lives, and sometimes it might be tough for some versus the others. So I just wanted to send out that message that yeah, I hope at least everyone has a good 2026. If there was a lot of uncertainty or ambiguity, you get clarity, and if there are any health maybe problems, you get better.
That's a
So
wonderful sentiment.
that's one wish. Now,
Well, that's a side of you I haven't seen before, Carlos. You pulled on my heartstrings a little bit there. It's wonderful.
so one thing we need to change is believe in yourselves as medical affairs. Stop thinking that you're just the data people who need to sit on the desk at the back. You are more than what you think you are, and you are more than what others think you are. Take a seat, bring your contributions, show the impact that you can bring, and trust me, based on experience, that you will get that seat on the table and you will get that voice if you ask for it. So be proactive, and look for the value, the impact that you can bring. And when you put it on the table, nobody is going to ignore you. So that would be my wish for people in medical affairs. Forget about just being the data experts. The future does not need any more data experts. We have tools that are now the experts. The future needs people who can contextualize the data, who can tell a story with the data, who can really bring the empathy and the patient to the center of every conversation, because AI now does not do it properly. And we still need to really play a leading role in that.
100%. Really wise words. This is, we're in the business of helping people, and we need to remember that we are people ourselves, and to take care of each other and ourselves. Yeah, I'm with you, Carlos. Also wish our listeners a happy, prosperous and safe 2026, but I also wish it to you, my friend. It's been wonderful catching up with you. I'm so pleased we got to finish off the year with having a chat with my good friend. I don't know what meetings you're going to next year, but I hope to cross paths with you again at one of them. I'm sure there'll be one or two. I've promised, to your point, to maybe back off a little bit on my trips and take a little bit better care of me and those around me next year.
You need to. You need to do that.
I spend a lot of time in the air. I won't have as many miles, but I might get a few more hugs from my little kids, and that's the main thing. So, mate, all the best. Stay safe, be happy, and best wishes to you and yours. Speak soon.
Thank you.
See you, mate.